health as a right is a corporate responsibility of all citizens. That's my opinion.
Hello and welcome to Healthcare. Today I am Aisha Sadona. On this program, we bring you all the health happenings around Nigeria. Happy World Health Day. The World Health Organization Council on Economics of Health for All has stated that at least 140 countries have the right to health care in their constitution. But only 4 countries have actually mentioned how to finance this right. Did you know that Nigeria is one of those countries that have the right to health care in its constitution? How have the government been able to implement this right so far? To answer all our questions, we have a practitioner in the building. He has been in the healthcare business for over 3 decades. We'll be talking to him right after this breaker. Don't go anywhere, we'll be right back. Welcome back. Let's get into the discussion with our guest. Our topic is health as a constitutional right. You're welcome on the show.
Thank you for having me, Aisha. Thank you. My name is Dr. Benson Ayodeliko. Again, I've been introduced by Aisha, and then we are celebrating the World Health Day, and I think it's important that we actually speak on this subject matter of health as a right, because it's a constitutional right, like you said. So we're happy to be here. Thank you.
Yes, sir. Health is considered a fundamental human right in Nigeria, yet many citizens are unaware of it. Why do you think that is?
Yeah, I mean, it's clear that it's a fundamental human right that Nigeria has signed up to in the various charters. First, the African Union has health as a right in its charter, on the human rights and people's rights, under the human and people's rights. It's a right, yes. In the Nigerian Constitution, in Chapter 2 of the Constitution of the 1999 Constitution as amended, is a right. In the National Health Insurance Scheme, there was a commence from 2005. It is a right. But then, like you said, we are not aware, people are not aware, the citizens are not aware, because there has been no clear-cut implementation guideline or implementation strategy rather, to actually make it a right. So you can't go as a government promoting that health is a right to the citizens when you have no clear-cut pathway to making that right a reality. So I think because as far as we are concerned today, from where we are as a nation, it is not yet feasible to practice it holistically, and that is why government has also not taken the time to educate the citizenry that your health is your right. Access to healthcare. Access to healthcare is your right. I think that is the reason, because if you go broadcasting everywhere that access to health is your right, and you can't make that right happen, then it's a problem. Yeah.
Do you think that government have been able to implement this right so far in the best way they can?
Well, yeah, with the best intentions of government, they can only do what is possible per time. To implement health as the right of every citizen requires huge budgets to do that. The few countries like UK, Canada that has been able to do this, they spend a significant chunk of their budget, of their resources financing healthcare per year, because they treat health as the right of the citizen. So each time anyone is sick, you have the right to go to the hospital and all of that. I think at the end of the day, what is important really is in implementing the right to health care, who pays the bill? This is where the challenge is. Who pays the bill? Today in Nigeria, whether you're obtaining healthcare service from the public sector, hospital, or from the private sector, you are paying from your pocket. To a large extent, there is still a lot of out-of-pocket payments that Nigerians do to be able to have access to health or to healthcare service. Therefore, you can't say in that instance that it is a right, being implemented. You need to look at it from two perspectives. First and foremost, in making this right a reality, the availability of the required healthcare services has to be guaranteed, and the ability to access those services at the time of need also has to be guaranteed. So these are two, straightforward issues that needs to be addressed before health can be implemented as a right to every citizen of the country.
In the year 1978, at the Alma-Ata World Conference, a goal was set to achieve health for all in the year 2000. We are now in 2024. Can you say that goal has been achieved so far?
Thank you. So, Health for All by the year 2000, the Alma-Ata Declaration, was actually a global strategy, that all nations of the world by year 2000 were supposed to attain, access to primary health care. All citizens from across the globe, in different countries are supposed to access healthcare by the year 2000. But that didn't happen, obviously. 24 years later, we are still in that same situation where we don't have universal healthcare coverage for our population as a nation. The Alma-Ata Declaration also identified the fact that for health to be available or accessible to all by year 2000, then emphasis had to be laid on primary health care, the provision of primary health care. So nations began to make efforts to provide access to primary health care to their population. Nigeria, of course, wasn't left out, just that unfortunately, having built all these primary healthcare centers over the years, established them in all the local government, 774 local government areas of Nigeria, across ward levels and unit levels, the challenge is operationalizing those primary healthcare centers, making them operational. Like I said earlier, Nigeria today has over 33,000 primary healthcare centers, but only about 1/3 or less is operational. Operationality has to be, in the sense of equipping and also having manpower to run those primary healthcare centers. So until you have all the PHCs, as we call them, primary healthcare centers, operating across the population, whether you're in the urban or rural area, to be able to have access to healthcare, then we cannot say health is available to all.
In a country that has attained health as a fundamental human right, what are the common things one can say?
Yeah, very, very nice question, because there are actually indicators of what you might call signposts that can draw your attention to the fact that really health is a right in this population. For instance, you go to many advanced countries and you dial 911 or whatever emergency numbers they use, an ambulance shows up at your doorstep, okay, to render care right there on the spot, and then for emergency evacuation to hospital, okay. Nobody is asking you to pay any money at that instance. Nobody cares whether you have money in your pocket or not. Okay, an ambulance just shows up because you dialed an emergency number. That country obviously views the health of the population as a right. Now, even when the individual in question has just finished committing a crime and yet dial 911, the ambulance service will still attend to that individual, okay, ensure that the person is kept alive and healthy until prosecution by police can then take over from there. So first, the healthcare of the citizen is treated as a right, as a guaranteed right. There is a law in the US, for instance, that says any citizen, any individual that enters through the door of a hospital, whether this hospital is private hospital or public hospital, is guaranteed access to healthcare at that moment. If the person is an emergency, has to be stabilized, has to be treated, has to be, made comfortable until such a time that the patient can, answer the questions around who pays the bill. Do you understand? So that is a country that treats health as the right to its people.
Lastly, what are your thoughts on the World Health Day and its importance?
Thank you. It's very important. The World Health Day is always, a reminder, to let us know that health is still as important today as it was last year, as it will be 10 years to come, because the health of a population ultimately affects the productivity of that population. So the issues around healthcare should always be on the front burner, and that's why celebrating the World Health Day is important, to draw our attention to the fact that government of nations needs to do more. For instance, if the theme we have this year, health, my health as my right, if we didn't have that theme, for instance, if we didn't have this theme, you wouldn't know that ordinarily access to healthcare is your right, isn't it? So it takes celebrating the World Health Day to bring these things to the forefront, so that citizens will know that one, it is your right to have access to healthcare. Two, your government has a role to play in that discussion. Also, individuals, communities, we all have roles to play in making health, a fundamental human right. Okay? Why do I say so? It's not just about what government does that guarantees our health, isn't it? Even our own personal behaviors, our lifestyles, what we do with ourselves, can make or mar our health at the end of the day. So, in guaranteeing, the right to health, we have a role to play as citizens. You have heard of passive smoking, for instance. You've also heard that cigarette smoking and smoking of all those things are dangerous to health. So, what if I tell you that if a smoker is in this room, every other person who is a non smoker in the room were exposed to 25% chances of having complications from smoking just by being in the room where you have a smoker? All right. So we are not smoking, yet somebody else's behavior can literally impact our own health and infringe on our right to health, isn't it? Now, the way we practice waste disposal, for instance, you know, can affect population health. And that doesn't have anything, most times it doesn't have anything to do with government, just individual practices, community practices. How people, preserve their food, how people preserve their water, how people, practice farming, how people, just cultivate their crops, can affect the health of the population, which has nothing to do with government. So health as a right is a corporate responsibility of all citizens. That's the point I'm trying to drive at.
Thank you, Doctor, for taking out time out of your busy schedule to be with us today.
Thank you for having me.
This has been a Benson Coleman and Associate production. Remember, we all have a role to play in ensuring that health is our fundamental human right. Until next time, it's bye from me.